If your practice is busy, schedule full, team running, dentist in the chair all day, but the money isn't showing up at the end of the month, you're not crazy. I see this everywhere I go. And honestly, it's almost never the thing that you think it is. I've been working with dental practices for about 10 years now. In the last 10 years, over 5,000 practices have run on what we built. And in almost every single one, I see the same pattern. You probably know the feeling. You are working harder than you did 5 years ago. The schedule looks full. The team is running flat out. But at the end of the month, the numbers, just don't add up. You're producing a lot more than you're collecting. And nobody around you can really tell you why this is happening. The dentist is doing great work in the chair. But somewhere between the chair and the bank account, money is just disappearing. And I call this as a front desk revenue leakage. Here's what most practice owners have never seen. The average dental practice loses between 6 to 12% of the revenue they have already earned. I'm not talking about the production. I'm talking about the money you already earned that just never makes to the bank account. And after 10 years of seeing this up close, for a practice doing $150,000 a month, 8% leakage means $12,000 a month is just disappearing. That's a lot of money. That's $140,000 a year, just gone like that. And here's the thing that gets me. It's not one single place where the money is leaking. It's not one single hole, but it's 5 small ones, and they're specific places where revenue is quietly walking out the door every single day. And let me show you this 5 leaks and where they are happening. And here are the 5 leaks that most of the practices are not paying attention to. So let me go one by one here. Number 1, unscheduled treatment. That's sitting in your practice. Nobody's paying attention to. Your broken appointments, your hygiene drop-offs, insurance friction at the front desk, and your aging account receivable. These are the 5 important leaks that we're going to talk about. Every one of these is already tracked inside your practice management system. Every one of them is costing you money. And most practice owners have no idea how much they're costing them. So let me walk you through each one of them and what it is, how is it costing you. Let's take a deep dive into the first one, unscheduled treatment. This is the care that already been diagnosed. Maybe a crown, a root canal, a perio treatment. The dentist presented it and the patient said yes to that treatment. They wanted to move forward, but somehow nobody ever called them back to get it on the schedule. And that's frustrating. Here's what happens. By the day 60, the momentum is gone. By day 90, the patient has mentally checked out. The treatment just sits in your system forever, waiting for someone to do something about it. On average, what we have seen is that about 3% of these diagnosed treatments never get scheduled. That's around $4,500 a month. If you do a math, that's about $54,000 a year. Treatment your providers already did work to earn, and your operation just never captured. Now let's talk about leak number 2, broken appointments. The data on this is brutal. 7 to 8% of dental appointments are missed, and that's pretty normal. If your practice sees 40 patients a day, that's 3 empty chairs every single day. Think about that for a second. If you walked in tomorrow and saw 2 of your front desk people sitting there doing nothing for a couple of hours, you would fix it that day itself. You wouldn't wait, but 2 operatories producing 0 revenue, somehow that runs for years. And here's what really hurts. When a cancellation comes in, most practices have no way to fill that slot fast. Someone tries to make a couple of calls, gives up, the chair sits empty. That's about $3,500 a month. And that's before you count repeat no-shows that nobody handles any differently. Now let me talk about leak number 3, which is super important, hygiene drop-off. Here's a number that should stop you in the tracks. Only 60% of your hygiene patients come back within 12 months. 40% just disappear. I will let you think about that for a second. Let that sink in. If you have got 2,000 active patients, 800 of them are gone. Not because they switched to another dentist, just because nobody followed up after the first reminder went out. Nobody followed up after the first reminder went out. And when you lose a hygiene patient, you just don't lose $200 cleaning. I think that needs to be corrected. It's not just about the cleaning revenue that you lose. You lose every restorative case that would have come after those exams for the rest of their life. Hygiene is the most predictable revenue system you have. When that starts draining, everything downstream drains with it. That's why I call it, it's very important you pay attention to this leak. And let's talk about leak number 4. And this is the most frustrating leaks in almost every practice. Insurance friction. In most practices, insurance gets verified the day of appointment, sometimes not until the checkout. The patient sits down not knowing what do they owe for this treatment. Treatment gets presented, and at the end of the day, they find out the real cost and they're frozen. Here is something most people in dentistry don't even know. The average dental practice have claim denial between 10 to 12%. Let me repeat that. 10 to 12%. If I tell you what's in medical, you'll be shocked. It's under 3%. Dental is one of the worst in all of healthcare. And when patient gets blindsided at checkout, what do? They just postpone the treatment. They cancel. The cancellation turns into the patient who never comes back. So insurance friction alone cuts the case acceptance by 15, sometimes 20% in most practices. And let's talk about the last leak. The last leak is the super important leak. And this leak is called aging account receivables. This is what happens when the other leaks compound on top of each other. Patients leave without paying. Statement goes out, most of the calls doesn't get answered, and the balance ages from 30 days to 60 days to 90 days. Then what does the practice do? They write off. Here's the brutal part. After 90 days, you're collecting about 40 cents on a dollar. That money is just gone. When your account receivable goes above 25% of monthly production, that's when the cash flow really starts to hurt. For a $150,000 practice per month with an account receivable at 30%, that $45,000 sitting unpaid. Money you already earned just aging out. And here's the wild part. It's not because patients can't pay. It's because nobody asked them in a way that made the payments easy. So let's add it all up. For a practice doing $150,000 a month, we are talking about 8% in leakage, $12,000 a month, $144,000 a year, walking out the door of an average practice every single year. This is happening every single year. And if you're running a group, 10 locations, 20 locations, 50 locations, just keep multiplying that. A 10 practice DSO bleeds more than $1.4 million a year. Across most DSOs, this is the single biggest hidden cost in the operation, and nobody on the executive team is even tracking this. Here's what I really want you to hear. This isn't a patient problem. It's not a marketing problem. It's not even a staffing problem. It's a front desk problem. And until you fix the system, you're going to keep losing money no matter how many patients you add, no matter how much you spend on ads. So those are the 5 leaks that I want to talk to you about today. Unscheduled treatment, broken appointments, hygiene drop-off, insurance friction, and aging account receivables. If any of these sound familiar to you, you're not alone. Almost every practice I work with this have all 5. And if you are an office manager watching this right now, you already know all of this. You have been trying to tell your dentist for months. Go ahead, share this with your practice owner. Sometimes it just takes an outside voice to say what you have already been saying. The real question is, how much is this actually costing your practice? We built a free assessment that walks you through every leak and gives you real numbers. It takes about 2-3 minutes for you. The link is in the description. Check it out. Next week, I'm going to go deep on leak number 1, unscheduled treatment, the 6-figure problem hiding inside your practice that almost no one talks about, and it's almost always bigger than you think. See you.